Hi, and welcome to the second installment of the Health Literacy series. This is part 2, Why Should We Care? In part 1, we discussed the definition and multiple sides of health literacy. Now we're going to discuss some of the consequences of low health literacy, get an idea of who is affected by low health literacy, and take a moment to consider the impact low health literacy can have on a patient's experience. Why should we care about health literacy? This is an article from CNN Online about parents who are being charged after their 11-year-old son died following a heart transplant. The authors point out that what sounds like neglect on the part of the parents may be attributable to poor health literacy, shining a rather terrifying spotlight on exactly what we're discussing today. That's in Illinois. What does it have to do with us? Fair enough. Let's talk about us here in Louisiana. Now, it's not often that we're accused of being a blue state, but you may notice that Louisiana, along with some of our neighbors, is a nice dark shade of royal blue, which, in this map from Americans' Health Ranking, means that we are 50th in overall health, or number 1 at having the worst health. And we're not far behind in categories such as infant mortality, obesity, preventable hospitalizations, premature death, and smoking. So obviously there's room for improvement, but what does that have to do with health literacy? Low health literacy has been shown to have some pretty dire consequences. The Institute of Medicine report of 2004 described health literacy as a silent epidemic, with nearly 90 million Americans lacking the literacy skills to successfully function. As you can see, low health literacy leads to worse health outcomes. Patients with low health literacy, as you can see represented by the bar on the right, are twice as likely to be hospitalized as literate patients, the blue bar on the left. And when they get to the hospital, they often need to stay longer. They don't understand treatment regimens, they make medication errors, they present when it's too late, and they often use the ER in lieu of primary care. But surely this is attributable to those other factors we're always hearing about that impact health, like income level, race, education. Well, the AMA identified health literacy as the strongest predictor of health status over any of those things. Turns out it's not that complicated. Health literacy predicts health status. And from a fiscal standpoint, that has some pretty serious consequences, costing the U.S. an estimated $238 billion a year. So, low health literacy matters, sure, but all those statistics are probably just because of a few people draining the system, right? In 2003, the U.S. Department of Education conducted a national assessment of health literacy among almost 20,000 U.S. adults. They categorized people into having proficient health literacy, intermediate, basic, or below basic health literacy. Which category do you think matches with each color on the pie chart? How'd you do? It's worth noting that the below basic category was composed primarily of Hispanic and Native American people, as well as adults over 65. We can see on the graph that intermediate health literacy is by far the largest category. But what does that mean? Categories were determined based on a 67% probability that a person could complete a given task, meaning that about 2 out of 3 people in the below basic category could successfully circle a date on a doctor's appointment slip, and meaning that there was only a 67% chance that an individual in the intermediate category could determine what time to take a prescription medicine based on the label. This kind of task is something that I, for one, would take for granted. So let's take a look at another study examining just this question. Can patients understand how to take medication after reviewing instructions on pill bottles? Out of almost 400 clinic patients across 3 states, almost half did not understand instructions on at least one label. And even out of the patients with adequate literacy, almost 40% missed at least one label. We can't assume that just because someone can read, they can interpret medical language and jargon. And unfortunately, it's not just confusing pill bottles that are to blame. Mayo Clinic conducted a survey of patients leaving the hospital, where they interacted with real live healthcare providers, gauging their understanding of vital takeaway information from their hospital stay. Keep in mind, these are not just patients identified as low health literacy. These are all comers. They found that less than a third of patients could name their medications, barely over a third knew the purpose of their medications, and less than half even knew their diagnosis. Let's recall the definition of health literacy that we discussed last time as we consider this data. By definition, health literacy means not only the patient's ability to obtain, understand, and act on health information, but also the provider's capacity to communicate clearly, educate about health, and empower their patients. So now let's consider what it can be like to be a patient. I'll put a written passage on the screen for you to read. It simulates what a reader with low general literacy sees on the printed page. Read the entire passage out loud. Seriously. You have 1 minute to read. And I'll give you a hint. The words are written backwards, and the first word is cleaning. On your mark, get set, go. "40 seconds left." "30 seconds." "20 seconds." "10 seconds left." And stop. Did anyone finish? How did you feel while you were trying to read this passage? Do you know what you were reading about? What if this was about your healthcare? Would you know what to do? Reading unfamiliar terminology can be a lot like what we just did. And keep in mind, the healthcare system can make it hard for patients to tell us they don't understand.
This is bad enough. This is bad enough, so please don't give me gobbledygook. Don't give me pages and dense pages and this leaflet aims to explain. Don't give me really dodgy photocopying and do not remove for reference only. Don't give me drafted in collaboration with the multidisciplinary stakeholder partnership consultation short life project working group. I mean, is this about you guys or me? This is hard enough, so please don't leave me oddly none the wiser or listening till my eyes are glazing over. Don't leave me wondering what on earth that was about, feeling like it's rude to ask or consenting to goodness knows what. Don't leave me lost in another language, adrift in bad translation. Don't leave me chucking it in the bin. Don't leave me leaving in the state I'm in. Don't leave me feeling even more clueless than I did before any of this happened. This is tough enough, so please make it relevant, understandable, or reasonably readable at least. Why not put in pictures or sketches or something to guide me through? I mean, how hard can it be for the people who are steeped in this stuff to keep it up to date? Do you know what I'd appreciate? A little time to take it in. a little time to show them at home, a little time to ask, what's that? A little time to talk on the phone. So give us the clarity right from the start, the contacts there at the end. Give us the info you know we need to know. Show us the facts, some figures, and don't forget our feelings, because this is bad and hard and tough enough. So please, speak like a human. Make it better, not worse.
In addition, as healthcare providers, we have to remember that our role in health literacy is more than just a courtesy to our patients. Patients have the right to understand healthcare information so that they can make safe decisions for themselves. And healthcare providers have a duty to provide information in simple, clear, and plain language, and to check that patients have understood the information before ending the conversation. To recap, in session 1 we talked about the definition of health literacy. Today in session 2 we discussed why we should care about health literacy. Next session, we will review some strategies for promoting health literacy and effective communication with all of our patient interactions. See you next time. Thanks.